Okay, let's take a look at a couple of diseases of the lymph system. Again, this is not meant to be every disease that could be out there, but let's look at a couple of the large diseases you may see inside of a medical practice. All right, first up is lymphoma. This one is going to become very obvious once we break the word down, so let's start with that word breakdown. All right, so put this down into our prefix, root, suffix, our total definition. Hit pause if you need to. Tell me what you get for this word breakdown for lymphoma. Okay, so the prefix, there is none. The root term is lympho, which refers to our lymph system, the lymph blood vessels, the lymph fluid that flows through there. And the suffix oma refers to a tumor. So lymphoma really is a tumor or a cancer, if you want to be a little bit more particular, inside this lymph system of the body. There are many different subtypes of lymphoma. I know I'm just kind of showing one here, but you can certainly do some research on the various types. But anytime you're looking at any of the different types of lymphoma, it is a type of cancer inside those lymph vessels, those lymph nodes. It's really just location and how fast it's spreading that puts it into the different subtypes because it will change how we treat it. Okay, next up is another common one, and that is lymphedema. Again, we can really get a good idea of what's happening here if we break down the medical terms, so let's do that first. Okay, so let's see if you can find the prefix, the root, the suffix, and the definition of the term lymphedema. Okay, so there is no prefix. The root term here is lympho, which again refers to the lymph system. We do have a suffix here, edema, which refers to swelling. And edema can be, or edemo can be in the center as a root term. In this case, we're going to choose the suffix, meaning as it's at the end, and it is swelling. So this one refers to swelling of the lymph vessels or that lymph system. So let's take a look at this picture again. And you can see the patient's right leg versus their left leg, right? That left leg has some significant swelling compared to that right leg. Okay, and this really isn't something that the patient did or caused. It's not a fat buildup. But what's happening here is that there is some damage to the lymph capillaries, those lymph nodes, and it's preventing that fluid from continuing to circulate around the body. Now, there's a lot of reasons this could happen. Sometimes if you have surgery, I can tell you just from a personal experience, I've had 2 knee surgeries, and that created a lot of this lymphedema for a few days. From that damage. Could be other diseases that cause this, could be some kind of trauma, but you're not having proper flow through that lymph system. If the lymph system can't get that excess fluid out of the tissues, you get this excessive swelling that you see. All right, next up is lymphadenopathy. Again, we're going to break down the term, and then we'll come back to the picture and kind of see what's happening based off the medical term definition. So let's see if you can break this down first because it's going to tell you what is occurring. Again, hit pause if you need to. Okay, so in lymphadenopathy, we do not have a prefix. We have 2 root terms here. So lympho refers to that lymph system, the lymph vessels. Adeno refers to your glands. And the suffix here is pathy, which refers to a disease. So lymphadenopathy refers to a disease of the glands and that lymph system that we just talked about. This is usually due to some sort of an infection, and you can see here this is underneath a patient's chin. I know it just looks like there may be some fat deposits, but what's really happening here is that you're losing the definition of the chin underneath as it leads into the neck because of so much swelling in the glands and those lymph vessels inside that neck due to an infection that everything is sort of puffed up with excess fluid.